So tonight we are honored. You know how everybody always says when they introduce someone, oh, I'm honored to introduce. I am really honored to introduce Scott Atlas tonight. Yeah, he's the Robert Wesson Senior Fellow in Healthcare Policy at the Hoover Institution. His career and contributions to his field can only be described as distinguished, highly distinguished. He's a frequent policy advisor to government and industry leaders on healthcare and medical technology around the world. He lectures nationally and internationally on a variety of topics, most notably the role of government and the private sector in healthcare quality and access, global trends in healthcare innovation, and the key economic issues related to the future of technology-based medical advances. Dr. Atlas served as Chief of Neuroradiology at Stanford University Medical and trained over 100 neuroradiology fellows, many of whom are now leaders in the field throughout the world. He is also the editor of the leading textbook in his field, now in its 5th edition, officially translated from English into Mandarin, Spanish, and Portuguese. He's been editor and associate editor and a member of the board of numerous scientific journals and national and international science societies over the past 3 decades. And for those fighting Illini listening tonight, I must mention he was also honored with the 2011 Alumni Achievement Award, the highest career achievement honor for distinguished alumnus from the University of Illinois, Champaign-Urbana, his alma mater. So most of you are familiar with Dr. Atlas because when called, he served the nation from August to December 2020 as special advisor to the president and a member of the White House Coronavirus Task Force. So usually we reserve our expressions of appreciation to the end of the evening, but in this case it's appropriate to do so at the beginning. We've not had a chance to thank Dr. Atlas for being with us on Zoom when he spoke in June of 2020. He spoke presciently of things to come, noting the very real health issues with and outside of COVID that would unfold. And I can tell you from our first contact, I could hear the concern in his voice, especially about the children and the impoverished that he knew then were going to suffer the most. So in these times when our government deemed who was and was not essential, we feel it incumbent upon us at Liberty Forum to acknowledge those attacked, deplatformed, disparaged, those who ironically have actually proven themselves essential to the discussion of the existential threat we currently face. Doctors such as Jay Bhattacharya of Stanford, Dr. Henry Risch of Yale, Dr. Robert Malone, Drs. Pierre Corey, Paul Merrick, Peter McCullough, Brian Tyson, George Fareed, Vladimir Zelenko, and many others previously highly awarded in their fields and who have worked tirelessly to save lives during this seemingly endless drama. It is laughable, and so we must, to marginalize prestigious, dedicated, distinguished doctors and scientists as fringe. So, yes, Dr. Atlas has received numerous prestigious awards and honors in recognition of his leadership in policy and medicine, including the 2021 Freedom Leadership Award from Hillsdale College, their highest honor. But tonight, our way of saying thank you, as our way of saying thank you, it is my privilege to present the first of a special award to give to doctors who've been smeared, respectable doctors who've been steered. So I would like to welcome to the stage the very first recipient of the Liberty Forum of Silicon Valley Essential Fringe Doctor Award, Dr. Scott Atlas.
Thank you. Thank you very much. Thank you. Thank you very much. Appreciate that. It's not the first time I've been called fringe, but it's the first one on a trophy, so it's very good. Thank you. Well, it's a great pleasure to be here in person. It is a delightful experience to be in a room full of people saying thank you. That's positive for me. Now, what I'm going to do is give a presentation. And the reason that it's important to give a presentation that is a lot of data that I'm going to throw at you is because the only way to assess what to do is to know what's happened. And that's a very simple concept, but it is one that I found to be sort of non-existent inside what was the task force room, frankly. And I wrote about this quite a bit in my book with some specific sort of painful remembrances of what happened there. But it's critical to know the facts so that we can proceed, and more importantly, to make sure this never happens again. And this is very, very important for all of us, whether or not you have children. I do. It's not just for now, it's for this future of this country. And as we know, the world to a great extent depends on what happens in the United States. And this again, can never happen again. So with that, I'm going to go through some slides and some data, and then I will answer questions until no one has any more, which that's a sort of a dangerous thing to say, but I'm willing to answer as many questions as you guys have. Now, what happened? Well, the first thing that happened was that the World Health Organization came out with some statements. This was then capitalized on and expanded by computer modelers, and that was grabbed onto by so-called leaders of public health and amplified by the social media. And that amplification was based on these following things. The SARS coronavirus has a higher fatality rate than the flu by several orders of magnitude. Everyone has a significant risk to die. No one has immunity because the virus was new or novel. Everyone is dangerous and spreads the infection. Asymptomatic people are major drivers of the infection. Locking down, which means closing schools and businesses, confining people to their homes, stopping non-COVID medical care, eliminating travel, will stop or eliminate the virus. Masks will protect everyone and stop the spread, and immune protection is only from a vaccine. And all of these things are false. Every single one of those claims is false. It was known to be false by the time I got to the White House at the beginning of August 2020, and it has only been proven more so that these things are false. The first thing we know about what happened in the United States was the policy was stated to be flatten the curve, which is a rational aspiration. It was logical at the time, it was temporary, and it meant to stop or prevent hospitals from being overcrowded. That morphed very soon thereafter into something that was irrational, impossible, and unprecedented, and that is stopping COVID-19 cases at all costs. Doctors Anthony Fauci and Dr. Deborah Birx of the White House Coronavirus Task Force advised lockdowns. And that included what I said: school closures, business restrictions, business closures, limits on medical care, limiting the way and the frequency of seeing your own family, including your elderly parents, and a host of restrictions, mandates, and quarantines. And following that advice, that Dr. Birx, as the task force coordinator, the head of the advice coming out of the White House, wrote in writing to every governor, in writing, and visited dozens of states and public health leaders and gave that specific advice throughout 2020, 6 months before I got there, during the time I was there, and after I left. That was followed by almost every governor. And the result is now roughly 800,000 American deaths have been attributed to the virus. Millions of families and children were severely harmed, particularly low-income families and the poor. If anyone concludes that the United States pandemic policies failed and that lives were lost due to the wrong policies, then one must conclude that the advice given by Dr. Deborah Birx and Anthony Fauci was grossly wrong, and that their lockdowns, the Birx-Fauci lockdowns, failed because the lockdowns were widely implemented. Now, what are the problems with this whole situation before we go into what the results of them were? Number one, the data is flawed. Why do I say that? Well, there are problems with PCR testing, with timelines and trends, and with this concept of death or hospitalization from COVID. PCR was an extremely sensitive technique for detecting pieces of genetic material. They were the definition, and still are in many cases, of what is a case of COVID. And they caused, a positive test on PCR caused isolation, quarantining, and categorizing the data. The problems are twofold. Number one, PCR remains positive for weeks, at times months in people, but it's only the virus is only contagious for up to 9 days. So if you're going to quarantine somebody on the basis of a positive PCR test, you're quarantining people that are not necessarily contagious. Secondly, there's a technical issue here. And by the way, I gave this information to people on the task force when I got there at the beginning of August. That was never spoken about by anyone in the task force room except me. The technique is something, depends on something called the cycle threshold. This is you would never have heard of this before, except now it's very important, because the cycle threshold is the number of times the test has to be averaged to detect the genetic material, the so-called virus. And when that cycle threshold is on the level of what was done, recommended by the FDA, but done throughout the United States, throughout the United Kingdom, throughout Israel, and many other cases, it impacts what you're picking up by the test. If the cycle threshold is 35, 97% of the time, it's not a live virus. It's a dead virus, a piece of virus, an irrelevant fragment of virus that is not contagious. That's known. That was known then. It was even reported by the New York Times by the time I brought it up in the task force. There's somebody else who knew that. His name is Anthony Fauci. In July of 2020, Dr. Fauci said, quote, at a cycle threshold of 35 or more, the chances of it being replication competent, meaning contagious virus, is minuscule. You gotta say it's just dead nucleotides, period. That's what he said. So 97% of positive PCR tests are not detecting someone who's contagious. Secondly, what does it mean from COVID-19? This is just coming out in the news right now. I'm sure everybody in this room has seen this stuff. I said it then. I showed them this chart. This is a chart from July of 2020. This is hospitalizations in Arizona from COVID. And what this shows, if you look at what's in blue here, these are the patients in the hospital who actually have COVID. COVID is a disease. Red plus blue is people coded as having COVID as their cause of hospitalization. The red are people that don't have any symptoms of COVID. They happen to have a positive test for the virus. So when you heard that hospitals were overcrowded with COVID patients, which they weren't, that was a lie. Okay, that simply was false. It was in Arizona, less than a third of hospitalization patients that were coded, categorized as COVID, had COVID. 2/3 were hospitalized for something entirely different. They happened to be tested because every patient was tested and is tested for the virus. Hospitalized patients in the pediatric population are grossly overcounted. This is data from Stanford study in May of 2021, reviewing the data that I had distributed many times back then. And what this showed is that of the people called COVID, hospitalizations of kids in the pediatric hospital of Stanford, about half of them had no symptoms of COVID. 0. Okay, we're not hospitalized for COVID. This is the Stanford doctors themselves, who don't agree with me about much about COVID, as you may know. They were admitting this on chart review. Okay, this is very important when you're talking about what is the danger, what is and therefore the fear. Anyone who has a child, the most fearful thing you could hear is that your child's at risk for a serious illness. This is a larger study in California of a larger healthcare system. 86% of people that were called COVID in the pediatric population in the hospital for COVID, 86% were not COVID in retrospect. The CDC occasionally gets things right and shows some data that's believable, although that's infrequent. And what they said in their analysis, this is a study about 2020 data, deaths from COVID, they said on review that more than a third of patients under 18 that were called death from COVID had nothing plausible as being COVID. Okay, so we are in an era where trust in very vital institutions has been completely destroyed because they've lied. What about the risk and who's at risk? This is the critical part to understand, and this, although everyone here probably knows this, it's sort of never discussed, it's infrequently discussed really, even today. Okay, the original World Health Organization estimates was that 3.4% infection fatality rate, which is extremely high. The truth is, and this has been verified in multiple studies as I've listed here, is that the infection fatality rate, if you're under 70, is 0.05. What is that sort of comparable to? Something called influenza. It's on the same order as the influenza infection fatality rate. If you're under 70, okay, that's not to say that this is not a dangerous infection for the people who are in danger. Who's in danger? Number one, older people. Okay, we know this. The average age of death, the median age is 80. 80% of deaths occur in people over 65. The infection fatality risk, the fatality risk is over 1,000-fold difference for somebody young versus somebody old. And for perspective here, in Germany, Italy, the UK, and the USA, the median age of death from COVID is equal to or older than life expectancy. Okay, now that's not saying that we don't care, but it is saying there's a perspective here that you have to have about this virus. The other thing is, it's not just old people that are at risk, but it's also not all old people. Okay, there are other people that are at risk. Immunocompromised people, children with leukemia, extremely obese people. But a person who's out there and otherwise healthy, who's 75, their risk is not very high from COVID. That's a fact. That's not an opinion, by the way. That's not arguable on the basis of fact, what I just said. It turns out, and I said this actually on the news last night, I think, that about 2/3 of deaths from COVID are in people with 6 or more comorbidities. Okay, now it's true that there's a lot of people in the United States with a comorbidity. Okay, I happen to have high blood pressure that's treated. That's not a significant, in isolation, hypertension is not a risk factor for death or severe illness from COVID. That's not true to say that hypertension as an isolated thing is a significant risk factor. I was the only one who said that. I presented the data, I presented the science papers that prove that in the task force meeting. Either they didn't know it, which they didn't accept what I said, and they just said, I'm an outlier. This is the level of discussion there. Now, by the way, not every risk factor is equally important. Obesity is a significant risk factor. Diabetes with complication is a significant risk factor. What does that mean? That means someone who's diabetic with chronic renal failure, kidney failure, with severe peripheral vascular disease. These are consequences of diabetes. But controlled diabetes in isolation is not a risk factor for death from COVID. That's not an opinion, that's scientific fact. Nobody else says that. The fact is COVID is not very dangerous for most people, and the risk of dying is far lower than initially thought. What about the risk to and from children? This is California data. What does this show? It shows that of the cases and deaths in California, there were 14.1% of cases in people in children in California. Cases, 0% deaths in California in children from COVID. That doesn't mean 0 deaths, by the way, but it's rounded to 0. Just for perspective, in the flu season of 2017-18 in California, 5.4% of deaths were in children in the influenza season. In Florida, the case fatality rate for people under 16, and in fact for people 16 to 29 in Florida, is 0.0% case fatality rate from COVID. What about the risk from children? I'm just not going to go through all this, but this was known in the spring of 2020 from studies in more than a dozen countries that healthy children have an extremely low risk from COVID of significant disease and near zero risk of death. And children are only infrequent spreaders of COVID. This was known in the spring of 2020. The fact is that there is no increased risk in K through 12 teachers. In fact, if I had to design a job where I wanted to work and be safe from COVID, there's 2 jobs I would want. One is I'd like to be an elementary school teacher. And the other is I'd like to be an airline flight attendant, because there's never been a single significant outbreak of COVID on an airplane pre-vaccine, pre-mask mandate. Never. Yet we, as a country, are uniquely, other countries are crazy about mandates and things, but believe me, we are the only country of all our Western peer nations that closed the schools in September of 2020. All the Western European countries understood the data, and they had their own problems with COVID pandemic management. They kept their schools open. We were unique. That's immoral. That's a heinous abuse of public policy. Healthy children have extremely low risk of serious illness from COVID. Healthy children have almost 0 risk of death. Children rarely spread the virus to adults, and there is no special risk to teachers in schools, period. There is 0 excuse for a teacher to not have their blank in the classroom teaching the kids. Why open schools? This is a critical issue because, again, by closing schools, we have broken the basic social contract as a civilization we have with our children. And you don't have to be a parent to understand that. Healthy children do not have a high risk from the virus. The harms of closing in-person schools are enormous, and nothing is more important to a civilized society than educating its children. This was known by the time I got to the White House in the beginning of August 2020, and I said it, and I was the only person who cared. Online learning is a gross failure. It has nothing to do with, oh, not everybody has a computer. That's not the issue. Even in the Netherlands, the country with the highest degree of broadband and computers in their home, online learning is a failure, particularly for low-income families. Massive increases in F grades just from the spring 2020 closures alone in the United States. Stanford Education Group put forward a report, and their statement that began their conclusion was, quote, findings on learning losses are chilling. All these losses, as I mentioned, are far greater for minorities and poor. The lockdowns were a luxury of the rich, okay? And this is the other thing that is so heinous. There's nothing more antithetical to ethical public health leadership than making sure that the public health measures do not harm the most vulnerable in society. And that's exactly what was done. And the losses, of course, beyond learning by closing schools are enormous, particularly for lower income families. That's where detecting hearing and vision problems is done. That's where nutrition is received for a lot of kids. Conflict resolution. Anyone who's had a kid knows that they could teach them what's in the books, but they go to school for group activity, for learning how to resolve conflicts with their friends and with their non-friends, to get physical activity. They develop language. There's socialization. You don't learn that from sitting in front of a computer. But it was much more tragic than that. And we know this data. This is data showing medical claims went down during these lockdowns of 2020. All medical claims overall went down in teenagers. Except when you look at the mental health claims to insurance, and this is data, this is not an opinion, they were enormous and they were much higher. This is comparing year to year. 2020 during lockdown versus 2019. This is a tripling of self-harm visits to doctors in teenagers year to year compared to the previous year during the lockdown. That means these are kids who are putting out cigarettes on their skin or cutting their wrists. It's the biggest predictor, by the way, of suicide, to have to go to a doctor for self-harm. This is a massive increase documented year to year, 2020 lockdown versus 2019, in anxiety disorder, depressive disorder, and adjustment disorders in college-age students. This is drug overdoses year to year, exploding, and substance use disorders in teenagers, by the way. And I'm not going to go through all these, but just to show you the destruction from closing schools, more than half of college-age students in the United States during the lockdown had an unwanted weight gain, and that averaged 28 pounds. That's an enormous physical health disaster, and of course, it's a reflection of the lockdown, not the virus. The virus didn't do these things. Human beings who chose lockdowns did these things. That is not from the virus, no matter what you read. It's from the lockdown. Mandela said there can be no keener revelation of a society's soul than the way in which it treats its children, and that there can be nothing more to say about that, really. What do I mean by lockdown? And I define this here because in one meeting, and I mentioned this in my book, Dr. Birx said to me in front of 20 people, and then to them, nobody in the task force wants lockdown, okay? And I interrupted, and at that point I was pretty frustrated. And I said, wait a second, are you for closing businesses and schools? Yes. Are you for restricting hours of operation? Yes. Are you for limiting medical care for non-COVID disease? Yes. Are you for quarantining people who are asymptomatic? Yes. Are you for restricting personal movement and travel? Yes. Then that's lockdown, I said. And of course it is. What was the impact of the lockdowns? The lockdowns failed. They failed to stop the spread of the infection. They failed to stop the death in the identified high-risk people, and they inflicted enormous harm. In fact, the lockdowns killed people because of missed medical care. This is a study from Bjornskov, March 2021, in 24 European countries. The lockdowns, severe lockdown policies were not associated with lower mortality. This is a study from Stanford, Ben David and colleagues, January 2021, that reviewed 11 countries. They did not find benefit of the restrictive lockdowns on case spread. So first we see no decrease in mortality and death. Second here, no decrease in the spread of cases. And then the most eye-opening study of all is in June 2021 by Rand Institute in USC, who looked at 43 countries and the entire United States lockdowns. And they said that these lockdown policies actually led to an increase in death, excess death. That means deaths over and above what would be anticipated in a non-pandemic year. And so this gets rid of the issues of, well, was it a COVID death or not? It's just talking about death beyond what would be expected if there was no pandemic. That's called excess death. With longer shelter-in-place orders, more excess deaths occurred. With earlier onset of the lockdown, more excess deaths occurred. In the 43 countries with available data, the excess deaths were falling, but then once the lockdowns began, the death toll began rising. And the same thing was happening in the United States. The deaths increased once the lockdowns were put in. Lockdowns killed people, period. That's fact, no matter what anybody tells you. One of the many questions I asked myself in the spring and summer of 2020 was, where was everybody speaking out about this stuff? And one specific group, where were the economists? Why do I say that? Well, first of all, I work with some of the most famous economists, and I have a lot of respect for them. But there's a whole body of literature that is about what happens with severe economic downturns. Because what the media and the lockdowners put forward was this false dichotomy that if you were against the lockdowns, you were choosing money over lives. You've probably heard this many times. It's still sort of said. But that's again another, I'll use the word lie, because there's decades of economic literature. When there's a severe economic downturn, people die. Okay, that's a fact. This is established knowledge, but no one was writing about it. And then I got a call from an economist at the University of Chicago who had seen me writing on the research on the pandemic and doing interviews, and he said, Scott, we'd like to write a paper with you on the lives lost from the economic downturn of the lockdown, not the virus, the lockdown. And we did. And that was in May of 2020. And we calculated that the number of life years lost from the lockdown were double the life years lost from the virus at that point in time. Why was that? Well, that's because a lot of things happen when you have no money, including suicides, including drug overdoses, including spousal abuse and child abuse. But in addition, there was a fear inculcated into the public by the White House task force and by the people in government. And what they did was they said, we're going to close non-essential medical care, and which meant non-COVID care, basically, because it was very essential. When you have cancer, it's pretty essential, okay? And so what happened because of the fear, the narrative, the closure? Half of the 650,000 US cancer patients didn't come in. They skipped their chemotherapy. This is during spring, summer of 2020. About half of stroke patients and heart attack patients did not call the ambulance. They were afraid to go into a medical center. Organ transplants from living donors dropped by 85%. The need for the organ transplant obviously did not disappear. More than 2/3 of cancer screenings were skipped in the first 3 months of the lockdowns. Almost half of cancer diagnoses of the top 5 common cancers were never made. You think those people didn't have cancer? No. Those people will come back with later stage cancer, with spread. Many will die. Many others will have enormous pain and other, morbidity problems from their cancer. Severe child abuse cases skyrocketed by 35%, even though hundreds of thousands of child abuse was not picked up because the schools were closed. What is the significance of a 35% increase in severe child abuse? I've been a doctor that's been called in the middle of the night to make the decision, does the child go home or not? Is this child abuse? Because one way you can tell is by looking at head CT. And I was in neuroradiology at the time. People don't bring their child to the emergency room if they've abused them unless they think they've killed the kid. Okay, these are really severe cases of multiple broken bones, of very severe hemorrhage. And I apologize for being graphic, but that's the only way we can learn. This is not a story. This is hard fact that must be realized. Not only did that all happen, but again, the obesity in college-age kids, but most childhood vaccinations were skipped. The irony of all ironies, proven vaccines that save lives, these people were afraid to go in. An enormous public health issue awaits. I can tell you in the United Kingdom, which thank God we do not have a single-payer healthcare system here, in the United Kingdom, they're saying that it's going to be 7 to 12 years to make up the backlog on their chemotherapy and radiation treatments for existing cancer alone. What do you think is going to happen to those people as they wait? During the first 2 months of the pandemic, more than a third of the excess deaths in the United States, during the first 2 months, more than a third of the deaths, the excess deaths, were not due to COVID. They were lockdown deaths. Over the next 20 years, from the unemployment alone, the projection is that 1.2 million extra Americans will die from the lockdown. And that is hardest hit by, it turns out, women and minorities. When I say the lockdowns are a luxury of the rich, this is what I mean. When you look at the percent change in unemployment over the first year and a quarter, you saw that the low-wage earners, the low-wage jobs, there was a drop of almost 25% in employment. High-wage earners, there was no drop, none. These are what Martin Kulldorff, a friend and colleague of mine, calls the Zoom class. Okay, this is the people, like many of us, who are not affected by the lockdown that much. Many of us order our stuff from Amazon, order in food. Who do you think's working in these jobs, right? The so-called essential workers. Lockdowns in the United States caused lockdowns in other countries and inflicted massive worldwide harms. Why do I say that? Well, there's two reasons. Number one, when Dr. Fauci gets up on stage, that's very impactful. Other countries listen to what the US so-called leadership says. And secondly, we are a highly interconnected world. Everyone knows this. The interruption of the supply chain of medical care was enormously harmful. 400,000 new deaths from tuberculosis alone will occur in the world in this first year because of the lockdowns. Tens of thousands of babies died, extra deaths from malaria, because they can't get these simple supplies like malaria nets and all these other things that some of you may be aware of. This is from the lockdown, not the virus. More than 100 million more children will experience, in that first year, did experience sexual abuse, violence, genital mutilation, and childhood pregnancies. 369 million children. This is UNICEF and UN and World Health Organization type estimates here. 369 million children worldwide did not receive basic nutritional needs because school meals were unavailable. When an economic drop occurs in a poor country, that directly correlates to a decrease in life expectancy. Okay, the world is not the United States or France, right? And so when we see the continent of Africa or the Southeast Asia, India, places like Bangladesh, 97 million more people in 2020 alone were thrown into extreme poverty in the world, according to the World Bank. What does that mean? That means they live on $1.90 or less per day. 30 million people in India alone were thrown into poverty in that first year of lockdown. And as an example, which always strikes me as amazing, Bangladesh depends on one industry for most of their GDP, garment manufacturing. Okay, you can imagine if the Western world shuts down, there's not a lot of garments to be made. The entire country shut down. that was supplying, that industry alone, that industry was closed, 4.1 million families lost their only source of income. Okay, this is a worldwide epic tragedy caused by the lockdowners on the task force and the people who implemented the lockdowns. This is a study in the Latin American journals that talked about the world experience with lockdowns. And it turns out that they estimated, from looking at 124 countries, that 1.2 billion life years were lost due to the mobility restrictions, 25 times as many as to the virus during the first year. Lockdowns failed to protect the elderly. Lockdowns failed to stop the spread of the virus. And what must be known as the Birx Fauci lockdowns killed individuals, destroyed families, and sacrificed children, especially the low income and poor, while sparing the affluent. That's the science. Now, what is the alternative? There was an alternative. I wrote about the alternative, as did other people. It was called focus protection. The first person, to my knowledge, that wrote about it was John Ioannidis, an epidemiologist at Stanford, who's a colleague of mine. We did this independently. I used him after knowing about him almost every single day for the entire summer and fall for advice. And that strategy is increasing the protection of the high-risk group, increasing the protection of the high-risk group, and stopping the damage on the low-risk people of the lockdowns. It was falsely portrayed as a dangerous, reckless strategy to let the virus spread for some reason. That was a lie. The reckless strategy, the dangerous strategy, was the lockdowns, the broad lockdowns. And then many other people, Sunetra Gupta at Oxford, Jay Bhattacharya at Stanford, Martin Kulldorff at Harvard, many others put forward this idea of focus protection. And then finally in October of 2020, something called the Great Barrington Declaration was written by Sunetra Gupta, Martin Kulldorff, and Jay Bhattacharya. It's a very important document. What was the document? The document was two essential things: increasing the protection of the high-risk people, because the lockdowns were killing the high-risk people, and stopping the damage, the enormous harms to children and low-risk people. That was the thrust of the Great Barrington Declaration. And despite the fact that President Joe Biden, as a candidate, went on 60 Minutes and said no credible doctor believes Scott Atlas. And it turns out that, well, 43,000 plus medical practitioners, 15,000 medical and public health scientists, and 1 million people agree with what I said. That's a lot of nobodies. I'm fond of saying facts matter. They matter to me. I think they matter to most people. But they did not matter in the White House task force. But what are the facts? They don't matter to the media, by the way. I think we all know that. Okay, Florida, how did Florida do? We have an internal control. That's what sort of a scientific term for we have a comparison group here. We have Florida that did not do the severe lockdowns, and in fact, they opened up widely at the end of August 2020. They kept the schools open the entire state, the entire fall term beginning 2020 September, because of Governor DeSantis's understanding of the data. And they did not have these severe restrictions and mandates. How did they do compared to the country? After one full year of the pandemic, deaths per capita from COVID, Florida outperformed the country overall and 25 states. Remember, the burden is not on Florida to outperform, because Florida didn't introduce the severe collateral damage of the lockdowns. The burden is on the lockdown states to say they saved lives. Otherwise, all the harm they did was horrible, and they still didn't save anybody's life compared to people who didn't do the lockdown. So Florida's the controlled. Florida's the comparison. Excess mortality, Florida outperformed by 24% the overall USA after year one. Florida outperformed 2/3 of states. The age-adjusted COVID mortality, because remember, why is this important? Because COVID really mainly kills old people. Florida is the 5th oldest state in the country. And by the way, California is the 7th youngest. So Florida is at risk for COVID, whereas California has a significant advantage in this disease. How did that California-Florida comparison work? This is not something you're going to see on CNN, but most people here don't listen to CNN, I'm sure. Why do I compare them, first of all? Well, they're similar states in that they're very large, they're ethnically heterogeneous, they're heterogeneous rural, urban. They have sort of similar climates, although I don't think any of us think Florida's climate's as good as California. But the differences are what I said. Florida's the 5th oldest population, California's the 7th youngest. And Florida opened widely since end of summer 2020. California is one of the most stringent lockdown states. First thing to notice is this. What I'm showing here, green is schools open from August, September 2020 on. This is Florida. This is California. Look at the green. Okay, 17% roughly of students attended in-person classes in California. What about protecting people from dying from COVID? COVID mortality after year one, Florida was 30% better than California. Okay, again, the burden's on California to outperform Florida. They did the damage of the lockdowns. Excess mortality increased. Florida was better than California after year one. Then we heard the summer surge. The media went crazy in 2021 because they said, oh, look at the cases in Florida and the South in the summer of 2021. High, okay, yellowish white here is high cases, black would be 0. Okay, this is cases per 100,000. And this was a lot of cases going on in Florida and the South. Of course, and I wrote this in the book, I didn't know, I wrote the book in the summer of 2021, and I said, well, what's probably going to happen is that the cases are going to go down in Florida, and then they're going to go up in the rest of the country, which is exactly what happened. This is the October 3rd map. Very few cases in Florida, and most of the rest of the country had a lot of cases. Why did I predict that? Because that's exactly what happened the year before. In July of 2020, a lot of cases in Texas and the South and Florida, very few elsewhere. And then in the fall, at the end of the summer, very few cases in Florida and the southern parts of the country, and a lot of cases. And that's exactly what happens because the virus is seasonal. What do we mean by seasonal? It doesn't mean that, okay, start of spring, we're going to get the virus. We don't know it like that, but we know it comes in waves, and it's a repetitious cycle. It comes and it goes. What about now? What's the situation, the comparison? Okay, excess mortality during the pandemic, the entire pandemic here. California had higher excess mortality than Florida, higher. This is the success of Gavin Newsom's COVID policies. This is the states. Florida outperformed, had lower COVID mortality, age-adjusted, than the average in the United States, and beat about 60% of states. Florida didn't do the lockdowns. You're not going to hear, I always wonder, I say this almost every day to my wife, why is it that we don't, I mean, I know the answer, of course, but why is it that we don't see coverage of a year and a half of people living normally in Florida with no problem here? There's no increased problem in Florida compared to the rest of the country. People are living normally in Florida for a year and a half now. Okay, I'm going to finish up with some slides on vaccines. Well, I'm not going to quite finish, but I'm going to almost finish. Okay, this is the data on the vaccines. This is not opinion, this is fact, it's not arguable. And the problem with vaccines, really, and the lack of factual discussion about vaccines, and the mandates for people who don't need a vaccine necessarily, and the obscuration of the data about the vaccine safety issues, the problem with that is that it undermines the reason for the vaccines. It has created a backlash against vaccines, even when vaccines have good, very important uses. And I'm going to show you what those are. This is Israel data. This is vaccine efficacy, that after a few months, basically 4 to 6 months in their hands, the vaccine effectiveness of blocking cases of infection was dropped down to below 40%, roughly 40%. That's not very good protection, but it was very good during their study against severe COVID and death. Severe COVID is defined as critical or death, meaning you need oxygen, mechanical ventilation, etc. The longer you were from your vaccine, the less protection you had against COVID infection. This is the Israel study. But throughout their study, there was very good protection against hospitalization, severe COVID, ICU requiring COVID, or death. Like 90%. That's very high. This is Qatar. And now why am I showing, by the way, the countries outside the US? Because I don't trust the US data anymore. And it's very sad to say that, frankly. It's tragic to say that. So I'm looking at other countries, and I look at Qatar, which you think, Qatar? I mean, this is not a country we would trust, except Qatar vaccinated almost everybody. So they have very good published data. And what this shows from October 6, 2021, was that the protection for the vaccine was very high against death, hospitalization, and the question about infection. This is about infection. Okay, after 4 months, the protection against infection drops to about 20%. That's not effective at preventing infection after about 4 months. That's the Qatar data. Against severe, critical, or fatal COVID, after the length of their study, really with adequate numbers, was after 6 months, still almost 90% effective. But that's very important. People that have a significant risk to die from COVID are protected, according to the data, from dying from COVID if you're vaccinated. This is data from Sweden, October 25th. Vaccine effectiveness against symptomatic infection. Okay, it drops significantly after about 4 months. Vaccine effectiveness against hospitalization or death drops if you take all the population, but it's still pretty good until you get to about 6 months out. Now, I looked into the data more in detail, and this is their data. I made this graph. They didn't show this graph. This is their data. If you're under 80 years old, the protection against severe COVID hospitalization or death up to 9 months out is very high if you're under 80 years old. Okay, no vaccine is 100%. That's not the point. But if you're 80, 90% protected against dying or severe disease with the vaccine, if you're under 80, and including high-risk people, that's very good. It drops after more than 6 months to 51% for people who are over 80. This is Sweden's data, and I happen to trust the data. What about the comparison of people who've had COVID and recovered to people who've been vaccinated for COVID? Okay, because this is another indictment of the CDC and the people you see as public health leaders. They refuse to acknowledge, and this is one of the only countries in the Western world that refuses to acknowledge basic fundamental science, knowledge that we've known for, I used to say decades until Martin Kulldorff corrected me and said thousands of years, that previous infection confers protection. And it's true about this specific virus. This is proven. There's no controversy about this data. August 25th, 2021 study. Protection of recovered people against versus vaccinated but never infected. Okay, that's a comparison here. Symptomatic infection, there's a better protection after infection and recovery without vaccine, I'm talking about here, by 27-fold than people who've been vaccinated but never had the infection. There's a better protection against all SARS infections, whether it's symptomatic or not, of people who've recovered from the infection but never been vaccinated, compared to people who've been vaccinated but never had the infection, by 13-fold. And it's more protective to have recovered from COVID but never been vaccinated against hospitalization, compared to people who've been vaccinated but never had the infection, by 8-fold. That's the data from that study. And there is no significant difference in that study, but they didn't write this, I looked at their own data, of the protection against symptomatic infection or infection at all. No difference between the group of recovered people but never vaccinated versus recovered people and then vaccinated. No difference. Okay, this is a follow-up study from Israel, December 5th, just a month ago. Protection against new infection. These three groups have the same protection against new infection. Recovered people but never vaccinated, recovered people who've then been vaccinated, vaccinated people who've then had recovery from their first infection. So in other words, if you've had the infection and recovered, no matter what, whether you've been vaccinated or not, you have the same protection against a new infection. All three of those groups, anyone who's recovered from COVID, with or without a vaccine, have far fewer new infections than the people who've had full course of vaccination but never infected. That's the data. Protection against severe COVID. People who have been recovered but not been vaccinated, recovered and then vaccinated, or vaccinated and then recovered, have equivalent protection against severe COVID. And people who've been vaccinated have a 4 to 10-fold higher rate of severe COVID than people who've been recovered from COVID with or without a vaccine. Okay, that's the fact. This is a chart to show it. This is, again, an Israel study that shows on this line the rate of new infections in people who've been recovered and vaccinated, or vaccinated and then infected, versus the people who've just been vaccinated and never had the infection. What about Omicron? This is a study from Denmark that just came out a couple weeks ago. Time since vaccine, Omicron effectiveness of the Pfizer vaccine, Omicron effectiveness of the Moderna vaccine. That's what I'm showing here. And what I'm showing is that after 2 months, the prevention of an infection, the vaccine effectiveness against Omicron, after 2 months post-vaccine, drops to 4 to 9%. Okay? That's just all infection. Again, remember, okay, I'm going to talk for myself here. I don't care if I get an infection that's going to make me feel lousy for 2 days, but I don't want to die. This is just infection. This is all infection. Okay? By the way, you'll notice in the limited data they have, after 1 month post-booster, these are people who've had 2 vaccines and the booster, 1 month later, the protection against an Omicron infection is down to 54% in 1 month after booster. So the people that think you should be vaccinating mandated vaccines to protect you against things like Omicron are making an assumption we're going to get a vaccine booster. It takes 2 weeks after you get your shot to get the immune response. So if you believe this is the data, so you're saying that you're going to have to be vaccinating people basically every 2 months ad infinitum, forever, to stop an infection here, Omicron, that's from all available data, is not very serious. Very few people are dying or get severe disease from Omicron. That's the data we know so far. This is vaccine effectiveness, same chart, but just to show you here what I'm talking about, that after 2 months, there's essentially no significant protection, okay, against Omicron. 2 months. Vaccines protect against death and severe disease. That's very important. If you have a high risk, a significant risk of dying or getting severe disease, it makes sense to me to take the vaccine. I'm nobody's doctor. I'm not recommending that to anybody, but that makes sense to me. Vaccines that have been invented here protect against infection, but that protection becomes very low after only 4 months or so, and nearly zero against Omicron after only 2 months. Vaccines do not protect against infection or symptomatic infection, as well as the protection after having recovered from the infection. That's fact. That's not arguable, no matter what the head of the CDC says. There are safety concerns that we've all read about, especially but not only in young males, about the vaccines. They've been poorly documented. There's been a lack of transparency about the data on safety, and there is insufficient safety data about long-term on these vaccines and about boosters. Why? Because the vaccines haven't been around for very long. The safety data in a normal vaccine takes 5 to 10 years to accrue. So by definition, we don't have enough safety data. This is the first time ever a vaccine has been used of this type. It's not a standard technology for the vaccine. And the boosters, the safety data that was presented to the task force, the current task force, Dr. Fauci and the current task force, was from Israel on the boosters. And that safety data was 30 days of safety data in single-digit thousands of people. And they said that it was safety data. That's not how things are done. This is a quote from editor-in-chief of New England Journal, Eric Rubin, on the advisory meeting of the FDA on vaccine approval in children. He said, but we're never going to learn about how safe the vaccine is unless we start giving it. That's just the way it goes. That's what he said. On the other hand, I said the US is an outlier. This is the United Kingdom's statement of their advisory committee that talks to their national health system on the vaccines. They said in September, just a couple months ago, the margin of benefit on a health perspective is considered too small to support advice on a universal program of vaccination of healthy 12 to 15-year-old children at this time. That's sane. That's rational. That's not the United States leadership. Okay, trust in institutions, as you can tell and as you know, has been severely damaged in the United States particularly, but elsewhere. And what do I mean by institutions? Well, media and social media, that goes without saying, but they've really gone beyond what they ever were showing. And why do I say it that way? Because it's my belief that the pandemic exposed things that existed. It did not cause them, it exposed them. Just like when certain people are elected to political office, it exposes people for who they really are. It doesn't create that. Science and public health agencies and journals have been politicized and have undermined their own credibility by publishing smears, politicized pieces, opinion pieces with no science whatsoever. Teachers and education leaders and academia, the universities in the United States are a disgrace, including local universities here. And why do I say they're a disgrace? Because universities are supposed to be the center of the free exchange of ideas. There's only one important thing that children learn in universities, in my view, or the most important thing, I should say, and that's critical thinking. And the way you learn critical thinking is to hear all the opinions, all the evidence, all the information. And instead, the universities have resorted to character smears, false declarations of consensus, overt censorship. This is a moral and ethical failure, and they have sacrificed our children, by the way, out of fear for adults. I have children. I'm not to be calling for them to be a shield for me to prevent me from getting an infection. If anything, I am a shield for my children. Now, America's media is an outlier, and I mean that in the most negative possible way. You would think that America's media was just like all the other media. That's not true. Okay, there was a study published in the National Bureau of Economic Research at the end of 2020. They looked at the American media and compared it to English-speaking foreign media. And what they showed about the COVID stories, 91% of major media stories on COVID in the US media, 91% were negative. They quantified this, negativity. Non-US English language media, 54% negative. In the US, stories of increasing cases outnumbered the stories about decreasing cases by a factor of 5 to 1, even when the cases were decreasing. The American media delayed stories on vaccine progress compared to the reporting of other countries. And the stories on Trump and hydroxychloroquine outnumbered all the stories combined on any work on the vaccine. Okay, there was an intentional negative distortion of COVID in the United States media. Negative school reopening stories in the US major media, 90%, non-US English-speaking media, 56% negative. Okay, our media did public harm. The legacy of that negative coverage and what the American leadership, public health leaders did is sinful. Okay, and I'm not saying that really, I'm not a religious person myself. I never use the word sin as much as I have this past 2 years. And why do I say it's a sin? Because we damaged a younger generation here by this sort of evidence here. This is back in summer 2020. This is fear of health consequences from COVID versus actual mortality. Age 18 to 24, a massive exaggeration in their minds about their health consequences from COVID, and ages 25 to 34 compared to reality. This is people over 65. They had a relatively precise assessment of their danger. And they were the only ones really at danger, aside from people with significant comorbidities. The question was asked in the end of spring 2021. Do you or do you not feel nervous about the prospect of any interaction socially? 50% of college-age students in the United States said yes. They're nervous about any social interaction. I mentioned the weight gain. Yes, many people gained weight during the lockdown, but no one gained as much. The highest frequency of unwanted weight gain was in the college-age students. The isolation, the lockdowns were more impactful psychologically to younger people. I'll finish with this, which is what happened sort of to me, but not just to me, which is the problem here. Censorship has become the norm in the United States. And this is no more apparent than on university campuses. And what I say here is 1984 meets cancel culture. There were 3 medical scientists at the same Stanford University: Johnny Anides, me, and Jay Bhattacharya. We all said the exact same things. In fact, sometimes I quoted them verbatim about who's at risk, about the low risk to children, about immunity in recovered people, about the ineffectiveness of widespread population masks, about the schools should be opened, about the harms of lockdowns and the need for doing a different focus protection strategy. We 3 all said the exact same thing. Yet only one was met with a rebuke from Stanford faculty. I wonder why. And I say that sort of jokingly, but there's actual fact to show that these people, Stanford University professors, are severely blinded by their political bias. And why would I care? I really don't care what they think of me, obviously, but what I do care about is they're educating our children. How would you like to spend $250,000 on your education at an elite university that was not teaching, not allowing the free exchange of ideas? I'm sure many of you have spent that money. California, by the way, voted 2-1 Biden over Trump. Stanford zip code, where you have to work at Stanford to live in it, 95% voted for Biden, 3% voted for Trump. The free exchange of ideas fundamental to democracy and a free society is under threat in the United States. That's a serious statement. We all know it. We must recognize it before we can fix it. What are we doing about it? Well, one thing I'm doing is I've started a new initiative with Hillsdale College called the Academy for Science and Freedom. And this is Hillsdale's PR statement, which says, to combat the recent and widespread abuses of individual and academic freedom made in the name of science, Hillsdale College is establishing its Academy for Science and Freedom. The Academy, which will operate out of Washington, D.C. Hillsdale campus, will educate the American people about the free exchange of scientific ideas and the proper relationship between freedom and science in the pursuit of truth. And I'm proud to work as one of the 3 scholars to begin this institute under the guidance of Dr. Larry Arnn, who's the president of Hillsdale, with my colleagues and friends, Dr. Martin Kulldorff and Jay Bhattacharya. And our first event, thank you. We've announced this, and our first event is me speaking in January in Washington, D.C., if anybody wants to come. I'll finish with this, which is the newspaper, the main newspaper in Italy, okay, Corriere della Sera. And this is an illustration that it took 359 years for the Catholic Church to admit that they were wrong, that the earth moved. I don't expect the lockdowners to beat that 359 years. I'll finish with this slide. Truth is incontrovertible. Panic may resent it. Ignorance may deride it. Malice may distort it. But there it is. That's Winston Churchill. Thank you very much. Thank you. Thank you.
Dr. Scott Atlas, ladies and gentlemen, wasn't that a treat? Yeah, yeah. Okay, today Fauci doubled down on vaccines as the answer, suggesting that there'd be a vaccine capable of responding to every variant. Dr. Atlas, has science been recused?
Okay, so there's a lot of things to understand about vaccines as far as medical perspective. In my opinion, I'm not sure why we would need a vaccine to stop a virus if that virus does not have significant consequences. And so when we talk about something like Omicron, what we're seeing so far, and this is what the world's data shows, is a significant disconnect between the increase in cases and the severe consequences of the cases. We are not seeing the commensurate increase in deaths and severe disease from this variant. What does that mean? That means that we're seeing what we would expect in a pandemic. As a pandemic evolves, as a virus evolves during the course of a pandemic, we get mutations in the virus. Certain variants survive and proliferate. Those variants may be highly contagious, but typically variants are less lethal. This is what we expect to see, what we hoped to see, and it looks like what we're seeing. So a frenzy to develop a vaccine against a variant that does not kill or severely harm many people seems a little bit misguided at the very least. So Yeah, I mean, I also think you have to look at the effectiveness of the vaccine, and this is how I put the vaccine into perspective. The vaccines are good for protecting against death and serious illness. That's what the data shows so far. Therefore, but they do not protect against getting infected after 2 to 4 months, and therefore they do not protect after a couple of months on spreading the infection. Therefore, the rationale to get the vaccine is as follows. It's a personally protective vaccine, but it's not a publicly protective vaccine. It does not prevent the spread of the virus. In fact, the data shows that the vaccine is not going to achieve so-called herd immunity, one of the most radioactive terms of the pandemic, which is a simple biological concept. So the mandated vaccines to prevent the spread of COVID are nonsensical because they don't prevent the spread of COVID. The vaccines do not prevent the virus from spreading. To think that if you are personally at risk, you should get the vaccine. You shouldn't worry about if the guy next to you has the vaccine. You are protected from death and severe disease from the data if you have a significant risk for dying by taking the vaccine. That's what the data shows. You are not protected unless you think you're going to get a new booster or a new vaccine every 6 weeks. Because after 2 months, the protection against Omicron is under 10%, right? I showed that. And it takes 2 weeks to get immunity from a vaccine. So if you're anticipating in 2 months you'll have no protection, you better get a vaccine after, say, 1 month, every month, forever. For a virus, by the way, that is not causing a lot of lethality and severe disease. So, I mean, the whole discussion like that is nonsensical. It is anti-science. That is just one of the many things that we see from the face of public health on TV that is simply equivalent to a flat earther. That's what that is.
Okay, how many of you, by the way, are interested in getting I'm not going to call it a vaccine, Dr. Atlas, because it's not. It doesn't prevent infection or transmission, so that doesn't make sense to me. How many of you are interested in getting a booster or a shot every 2 months? The new vaccine lifestyle in California, are we going to lead that? Anybody want that for an unapproved technology? Okay. So here's a question about the government. I think there are a lot of people that are interested in your experience in Washington, but let me ask a broader one, and then we'll get closer in terms of your experience with the individuals. The SEC was forced to re-examine its practices after the Enron disaster in 2018 with default swaps. The FAA suspended the plane and investigated how they approved a fatally flawed plane. When will the FDA, CDC, NIH, and DARPA be forced to examine the consequences of their decision and continued policies that have cost hundreds of thousands, I guess millions now, of lives?
Yeah, well, so I don't know the answer, of course. I understand the point of the question. I will answer it this way, that I do not expect the CDC, the FDA, or the people that are the faces of public health leadership to ever say they were wrong and that the pandemic is over or anything like that. And no one should expect that. No thinking adult should expect that. The way that this ends is to have, the burden is on individuals who are to be critical thinkers. Okay, it may be difficult to sort out some of the stuff, but it's not that difficult really. It's actually quite logical and pretty straightforward what the facts are. You have to figure out who to trust by virtue of them speaking with data, with facts, in a logical way. Individuals have to make, in a critical assessment on their own, the best decisions for themselves and their family. I do not expect the CDC, the FDA, or anybody else to somehow declare they were wrong, this is over, we can move on. I don't expect that.
Okay. So, In your opinion, let's talk a little bit about therapeutics, okay? Because there have been tens of studies about ivermectin. In fact, there was a really incredible one out in Brazil this week. The FLCCC doctors, Corey, et cetera, said if this had been any other disease, it would have been on the front page of every paper around the world. They were so excited about it. So you mentioned hydroxychloroquine and how that was politicized, and there's been a lot of effectiveness with ivermectin, as we know. What about these doctors who have been unwilling to use therapeutics to save their patients, Doctor?
Yeah. So the whole question of therapeutics, there's so many things to talk about. One is, this is one of the greatest failures of the NIH and the FDA in this whole thing, is that after 2 years now, there's still never been the appropriate large clinical trials done to prove that should have been done in the first months of this. It could have been done and should have been done in the first few months. And that was probably ended, certainly for hydroxychloroquine, as soon as President Trump said, it works, you should take it. But it's tragic. That's a huge failure of the leadership of the NIH to not have done that clinical trial. And what's worse is the fear that was put into the public prevented the trials from being done, because there was at least one trial that was started in Minnesota, I think it was, University of Minnesota. I may be wrong, but I think that was it, where they couldn't even get enough patients because this fear, this false fear was generated about drugs like hydroxychloroquine that actually are proven safe. Hydroxychloroquine's been used for 70 years. It's in many countries, hydroxychloroquine is over the counter. It's not even a prescription drug. Ivermectin is similar, that these are very safe drugs when used, certainly under a doctor's prescription. So that's a big failure. The second problem is that it is, as far as I know, unheard of for a doctor to be prevented from prescribing a drug that was FDA approved. Under any historical evidence, I'm pretty sure that if a drug is FDA approved, the doctor has the so-called license to prescribe that drug for anything they think is a clinically beneficial reason. Yet, in this, pharmacists actually literally would not fill the prescriptions. I know, this is factual. This is unheard of, unprecedented. So that was another failure. And then third, of course, comment is sort of what you asked, which is the doctors were not leaders at all. We're not, in my opinion, many doctors, I don't want to use the word most, I don't know, were failures in the pandemic because they were not talking about the public good. They were refusing to use their brains in critical thinking, and instead did something else, which of course harmed the public dramatically. So this is unprecedented territory in this country, as far as I know. What happened with the disallowance of prescribing drugs that were FDA approved already. It's going to be, I don't know how we're going to get out of this, but the answer to all of this really is letting people see the information, having the free flow of ideas and debates and evidence. We're starting to see more of that, but it's still, it's very harmful, the situation in the United States. The technology companies in our own backyard here control the message. I am one of many people who have been censored from Twitter. They pulled down a YouTube video of Governor DeSantis assembled a panel early 2021 of me, Dr. Bhattacharya, Dr. Kuldorf, and Dr. Gupta in front of reporters, and then YouTube pulled down the video, and then of course DeSantis called me up the next day and said, we're doing another panel on the censorship. And so I went back down there, which is very good, but that's what's needed. So there's no simple answer to all of this. It's a rambling sort of answer that I just gave, but there's so many problems, and we need, I'm hoping that people continue to step up and have the courage other scientists to keep going despite the smears, despite the censorship, and more of the groundswell of public support for information, hope will carry the day.
So I want to make a bridge between therapeutics and your experience in Washington, if I could, please. You know, most of us have heard by now that there obviously of ivermectin, hydroxychloroquine, of fluvoxamine, using melatonin and aspirin, all kinds of things, quercetin, right? All of these things that people are reading about, zinc. And the most basic one that we heard about was vitamin D. And it seemed early on, and then you may confirm this, that high vitamin D levels were a really strong determinant of how people fared in the hospital. Those with higher vitamin D levels seemed to do better. So there was a strange thing that happened, right? Vitamin D, we understood Fauci was taking it. I don't know whether that's true. But what's the real story about the conversation that you overheard in Washington about what people could do, basic things that American citizens could do in their home that might make a difference?
I never heard any discussion about readily available therapeutics when I was there. I was there from, I got to Washington.
Excuse me, can I just repeat that? You never heard a discussion about therapeutics, available therapeutics?
I never heard a discussion about readily available therapeutics.
Okay.
And what I mean, the difference in what I just said and what I'm trying to say is that, yes, there were developing drugs that were very beneficial, including monoclonal antibodies, for instance. Okay, these trials were being done. They were expedited, and that was one of the significant successes of President Trump's Operation Warp Speed. But I never heard any discussion about these readily available drugs that were already FDA approved. Never a discussion about they didn't work or worked. Nothing like that was talked about in the task force or in any other meeting that I was in. So I can't, and I can't speak to motivation because I don't know motivation. It's impossible that we can all make assumptions or conjectures about motivation, but I don't know exactly why. I think it's very complicated. I think there's a lot of corruption. And what I mean by corruption is there's a cartel of funding in science that is very sort of problematic, because the people that control the research funding in this area is the NIH and Dr. Fauci, and the people therefore control those same people control all the academic advancements of all the university scientists, and those people have to get the research grants to do their research, to get promoted, to publish their papers, and the journals are under the same control as the people who review the grants for funding. And so there's this cartel, this sort of, I mean, some people have used the word mafia-like group that controls everything in science. And when you have the people that control the funding and publication of research also be the people that control the public policy, okay, then you're not going to get a free exchange of ideas. I mean, it's impossible. And so this needs to be not just exposed, but fixed. That's one of the things we're trying to do in this institute in Washington, D.C.
So they are controlling the funding, but it's also so interesting because we see all these ads for pharmaceuticals on our TV all the time. So they're also paying for your news, which is...
And the pharmaceutical companies, also have an intimate relationship with the funding of research, with people's careers, with giving speeches and talks and supplying honoraria. And I have to say that the pharmaceutical industry in the United States is the best pharmaceutical industry in terms of innovation in the world. There's no question about that. But it's very complicated. And so the corruption, by the way, that I mentioned is not just financial corruption. Okay, there's a moral corruption. What do I mean by that? I mean that there's a lot of people with careers on the line about what they said and what they did, and their own egos and job does not allow them to say they were wrong. Now, who am I talking about? Well, I can tell you one thing. When you're a government bureaucrat for 40 years, you're not in that job because you're politically neutral. You're in that job because you're politically skillful at navigating a very complex environment by getting friends in government agencies, by getting friends in the media, and by getting powerful people in the private sector to support you. And so we should never trust people in government bureaucrat positions for decades to be experts just on the basis of their credential, which we all sort of have a tendency to do until now. And we can never have people like that in charge of something in a crisis ever again with no significant oversight.
Dr. Atlas, can you keep going?
Okay, sure.
Okay.
Yeah, no problem.
Okay.
Not on that answer, but something else.
No. As you can see, we have a lot of questions. I'm trying to pull them into categories because there are so many. But there are a lot of. Raise your hand again if you're a healthcare worker in here. I'm getting questions from nurses, people basically in healthcare believing all these lies that you put up. And what can be done in the hospitals and in the clinics to change this?
Well, so it's very complicated to listen to a family member's doctor just the other day give her complete nonsensical misinformation about needing a booster. I mean, this is in it. So in other words, I'm saying I have personal experience with listening to this stuff. What can doctors do? Well, I mean, first of all, we're seeing a lot of doctors and nurses have critical thinking. They've had COVID. They know they have immune protection, and they're not going to get or don't want to obey, a certain number don't want to obey these mandates, even at the expense of their job. So that's good. That's an example of critical thinking. We need people to become critical thinkers. I don't know I hate to overuse the phrase, but doctors and nurses, I have a tremendous amount of respect for them, obviously, but we can't be listeners and followers. We all have to take a different role now.
Actually, I think it needs to be closer.
Okay. We all have to have a different role now. We, people in the medical profession, people in all walks of life, and being sort of primary interpreters of the data and using logic, because a lot of this stuff, the reason I got involved in the beginning, in March of 2020, February 2020, March of 2020, I was astounded at the lack of logic about what was being said. And this is not something that complicated. And I ended up, instead of just ranting to my wife at the dinner table every night, I decided I better be productive and started doing research and writing about this. So a lot of the stuff is not that complicated, but we can't sit there and assume that some decree from above is correct. And what we hear on the media, we know by now, I think, that this is just a total disgrace. And so we need to be thinkers, honestly. That's just the answer. And we need to make sure we have the availability of the information, because you cannot be a critical thinker as a human being without hearing the information and then deciding what is correct and what isn't. I don't have an easy answer to these things. I'm sorry.
There are a lot of, is my mic on still? There are a lot of questions about Fauci, your opinion of him, and his credibility. So he's still singing the same song, and we wonder what your experience was personally with him and what your opinion is. Okay, so let me say it this way. I came into the task force. I was in healthcare policy for a decade, full-time, in an endowed chair at Stanford Hoover Institution. And before that, 25 years in medical science and academic medicine and clinical research and education. I came in, and what I saw was shocking. What I saw was Dr. Birx and Dr. Fauci. Dr. Birx was the head of the medical side of the task force. Dr. Fauci was the most visible face of the task force to the media, to the American people on the media.
These were in their government bureaucrat positions, both of them for 40 years. Okay, that's a very different background. I don't know if I said this story or not, but when I came in to talk about, if I had an agenda item on the meeting that I was going to ask about, I had a stack of 12, 15, 20 scientific papers. I had reviewed the world's publications. I knew all the data. And when I was asked my opinion, I gave my opinion by citing, by going through the statistics, by going through the papers, by saying this paper's not very good because the design is improper and therefore the conclusion's invalid. This is what people who are scientists or even just critical thinkers of anything do. And I would go through my little soliloquy on the data, and all I was met with was either silence by them or statements like, you're an outlier, you're fringe. And there was never a single time that I saw Dr. Fauci or Dr. Birx bring in a scientific, or Dr. Redfield, bring in a scientific paper, criticize the literature, rebut what I said with scientific data. It was just a totally different sort of thing. And so my goal was to bring in the information, to have a discussion based on the evidence. I furthermore did something else, which is I brought in the experts from coast to coast who were doing the research on the pandemic. I brought in Dr. Ladapo from UCLA, Dr. Bhattacharya from Stanford, Dr. Koldorf from Harvard, Dr. Meisner from Tufts University. These are people, pediatric infectious disease experts, vaccine experts, epidemiologists, public health experts. These were people doing the research on the pandemic. 3 of those people were active consultants to the CDC or the FDA at the time. I set the meeting up because I thought the president needs to hear from the experts, the scientists doing the research, the nation's top people, and he needs to have his questions answered. I set the meeting up so that Dr. Birx could personally attend. The meeting was rescheduled to make it that she could attend. The day before the meeting, she said, I'm not going. Now, you know, that's, to me, the behavior of a scientist is somebody who can stand up, go through the evidence, debate the evidence with other scientists, listen to the experts, listen to the researchers, have a communication. That's what I was trying to do. What I think is the behavior of a bureaucrat is to try to block information, to refuse to engage in the debate, to be afraid of engaging in the debate with the experts. And then after that happened, Dr. Birx went to the media and to the House of Representatives subcommittee and said there were, quote, parallel streams of information going to the president that she wasn't aware of, unquote. And I think to myself, okay, as an advisor to the president, my role is to provide information. My role is not to be a filter to block other people's information just because I don't like it. And, you know, this is just a disgrace and a totally delusional sort of assessment of what the role of somebody is as an advisor to the president. In a healthcare crisis, everybody has to do the best they can to get the most information possible. Okay, so, I mean, that's a sort of, again, it's another long-winded answer, but the reality is that the behavior of these people, and I'll give you another example that just came out in these emails that have been exposed. We've just seen, all of us probably in this room have seen the emails between Francis Collins, the director of the NIH, and Dr. Fauci in the spring of and summer and fall of 2020. Behind the scenes, I wasn't aware of these emails, of course. I was very naive. I was asked by the President of the United States if I would help, and the answer is yes, period. It's my country. People were dying. The policies were failures. And it had nothing to do with politics. I would have helped if President Obama would have asked me. I would have helped if President Biden would have asked me. Anyone who is worth anything would go and help when people are dying like that. So I said yes. But there were other people there that had different motivations, frankly. They were there to keep their jobs. They were there to back each other up. Not once in a task force meeting did Dr. Birx, Fauci, or Redfield disagree with each other. Not once. Okay, that's unusual behavior at the very least. And then it turned out that Dr. Birx explained after I left, I think it was January of 2021, that she and Dr. Fauci and Dr. Redfield had a pact that if either of them would have been fired, they would have all resigned. Okay, I think to myself, is that the behavior of people who are trying to help the country? I'm not going to answer that because the answer is obvious.
Is there any reason to believe that what you witnessed in that particular scenario in terms of a health crisis is any different from the way the rest of policy is made in Washington?
Well, my first thought was, my God, I hope it's different. But you know, I can say this, that there's a lot of people in politics and in that political world that are despicable people. Okay, I mean, I'm sorry to be so negative, but this is just the way it is. And I think, you know, this is obvious. I'm not saying anything that people don't know, unfortunately. There are very good people, too. And there are some very good people that I spoke to, in government, there's some very hardworking people, particularly young people that I met, and this is a very positive sign to remember, that were in the administration in various levels. People work very hard, and many of them, some of them I acknowledged in my acknowledgments of the book. So there are a lot of good people, but there's a lot of people who aren't. By the way, I do not want people to think that somehow the whole task force was not interested in ending the pandemic. Everybody on the task force, I have no doubt, wanted it to end. I don't think anything else. I just think that a lot of them were completely incompetent, had other motivations in addition, used other tools to sort of make up for their other concerns or whatever. But I was stunned at what I saw, and it's an example of why we need outside people, private sector people. We need more people engaged rather than less. We need to be wary of people who have their whole careers, in my opinion, in government. I just think we need to be very serious in any way we can about getting more and more people involved. And again, this is one of the things that people here have to understand. The way to affect change is to be involved and to not be afraid, and that's very difficult. Believe me, I was stunned when I was naive. That's the only reason I wasn't afraid. But in the end, we all have to take it very seriously and be involved. So, I mean, I'll stop there with that.
Okay. You all have offered a lot of really interesting questions about specific immunity and specific aspects of the vaccine. So I'm trying to consolidate a few of those for you, but one of them that obviously gets to all of us is about the children. So there was a question that if you had a 6-year-old, would you vaccinate them? And then the other one that's obviously very touching to all of us is pregnant women. One person's asking if you know somebody in the area who would write an exemption for people who have already had COVID and are pregnant. And also, should a pregnant daughter get a vaccine even though she's already had COVID? I know that OBGYNs are recommending this to people, even though we hear that these things end up in the ovaries, et cetera.
Yeah. So, okay, I have some answers and opinions and others I don't. Healthy children have extremely low risk from COVID and no significant risk of death. In the risk-benefit equation for a healthy 6-year-old, it would not make sense to get a vaccine. I mean, that's just, I'm not the only one who said this. Many people say this. It's obvious. That's the data. I'm not saying don't get a vaccine. If people make the decisions for their own families, that's fine. In terms of the pregnancy question, I'll answer it this way. If a woman or a man has had COVID and recovered from COVID, there is no data. The data suggests that I showed here that you are protected with or without a vaccine, about equivalent. So I don't understand the logic of having somebody who has had COVID get the vaccine unless they are a long time out and they are high risk. Okay, so that's a different equation, because remember, COVID for somebody who's 85, obese, with diabetes and congestive heart failure, okay, that's a different story than a woman who's healthy, 25, and had COVID. In terms of your pregnancy, there's not a lot of 80-year-old obese men who are pregnant, so they're not in that category.
Whoa, Dr.
Yeah.
Atlas, I have to challenge you on that. I don't
Right.
think we're allowed to say that anymore.
You're not allowed to say obese, you're not allowed to say man, I guess, I don't know, but
I think there's some kind of logic privilege thing going on up
Yes.
here. I'm going to disassociate myself completely
yes.
from that.
So I don't know the answer to that is, I think you need to have a serious second opinion from a different doctor.
Okay, so couple questions about other kinds of vaccines. Online, we're being asked in the room, what's the status of the more traditional vaccines or vaccines that are not using this mRNA technology?
So this technology is not the standard technology. I think the J&J vaccine and one of the others from Britain were more towards standard vaccine technology. The data has been evolving. There's less efficacy of the J&J vaccine, but there's some studies that show that it should have been a 2-dose vaccine. I think we're, I don't know what's going to happen with the other vaccines. Since the vast majority of people have had the mRNA vaccines and now that's what's there, remember the data on the protection against serious disease and death is good with the vaccines, okay? I know that the message has been distorted to make people think otherwise. That's not true, but it is not protective against mild to moderate reinfection after a few months. So I'm confident from looking at the data that high-risk people get a significant benefit from getting the mRNA vaccines. Now, if you were a kid, if you're 75 this is again a logic sort of equation to me. If you're 75 years old, 80 years old, 68 years old, and you've had a new technology vaccine, that's one situation. If you're a 15-year-old or a 20-year-old or a 25-year-old that's going to live for another 60, 70, 80 years, potentially getting annual mRNA vaccines, I'm a little reluctant to say, okay, yeah, it's good. Let's see the data. The problem here is that we've not seen enough safety data on the vaccines for repeated or long-term injections. And when you're talking, again, I'm just using common sense here. Okay, you're 75 years old. I'm not so worried about it as much in the long term as I am about my 25-year-old son. So I think these are all parts of the equation.
So, there's questions online and again in the room about the VAERS data.
Okay.
Evidently, it's extremely hard to make one of these reports. It's extremely time-consuming for the doctors. Has anybody experienced that? People are not making these reports in their healthcare environments. Have you seen people be reluctant to do so? Yeah, people are even reluctant to raise their hands because it's evidently very, very tedious and you're looked down upon for doing it. But I think most people know somebody who's had some kind of a vaccine injury. And I think actually a lot of people in here went to a funeral of somebody who, 27-year-old healthy young man who died, bled out after his vaccine. So what about the repression of that data, and, and if we can't trust the CDC and the NIH, how in the world would we trust that data?
Right, so the VAERS data are these self-reported complications from the vaccine. And yes, there's been a lack of transparency, there's been a lack of adequate data. There are people working on solutions to this. We can look at other countries and look at their very rational concerns about the safety in young people. I just showed you a quote from the UK's advisory group on the vaccine for children that did not advise for it. I think we're in a position now where there's clearly a lot of eyes looking at this stuff now. There's been a lot of public concern. There have been concerns raised by a lot of people. There are certain people to trust about reforming this, not just for long term, but for immediate. And I think we have to wait, and that's one of the reasons why we're cognizant of these complications like myocarditis in young males, or in other groups have other complications. And that's, right now, it has to be looked at as uncertain. For instance, when you have a young person who does not have a significant risk from the disease and has a risk from the vaccine, I don't understand the logic of giving that person the vaccine. Okay, I'm not the parent, I'm not, the mandator, but that's just inappropriate.
So I just want to ask a question from our audience. That I think you gave so much information and compared so many groups in terms of immunity, and this one there's a little bit of confusion. So
yeah.
Let me ask this one in particular. When you compare immunity of vaccinated persons that have recovered, are you including persons that had the virus but had no symptoms? So
yeah. So the answer is, the best the studies can do is document who they do it by positive test. Most of them are positive PCR tests. So that includes many people who have not had significant symptoms. The answer is yes.
Okay. This audience member asks, if a virus is a virus is a virus, how logical is it that we do all this masking, et cetera, for COVID and not for a virus like the flu or a regular cold?
Okay, so masks are a topic that I have a separate set of slides on. I avoid it only because, it takes too long, but it's really very simple. Okay, the best studies on masks are the following. I'm talking about widespread population masks. Denmark published a study in November 2020 in the Annals of Internal Medicine, a randomized controlled trial. That's the best kind of trial. They took over 6,000 people, half of them wore the mask, surgical mask, by the way. There's some nonsensical thing going on that, cloth masks don't work. It's not just cloth masks. Denmark has a study, surgical masks. Half the people had masks on, half the people did not use masks. There was no significant difference between the percent of people that got the virus, as documented by testing, between the groups of people with masks and the people without masks. No significant difference. There was also no significant difference in the masked versus the unmasked people in getting the 11 other viruses that were tested for, including influenza. That data was not new, by the way. The data on influenza was known. It was published by the CDC, May 2020. They did a review of all the trials on influenza, including several randomized controlled trials. And their data showed on influenza virus that there was no protection from general population masks, and there was no difference in spreading on people who had using masks. That's influenza. Why is that relevant? Because influenza virus is about the same size as this virus, which happens to be a size smaller than the pores in the surgical mask. So it doesn't take a genius to figure this stuff out. Hey, I don't know, when I wear a mask, when I'm forced to wear a mask, I should say, and I put sunglasses on, my glasses fog up. Okay, what does that mean? Okay, I mean, it's pretty obvious. But the data is the data. The Louisville study from 2021 spring showed that there was no difference in places with masks mandated versus not mandated, and there was no difference in places where everyone wore a mask, not just mandated, but actually wore the mask, versus places where they didn't, in the spread of the virus. That's University of Louisville, 2021. So the studies were done. This is another, I have a beautiful slide of the Earth spinning in that talk, because the Earth is round, not flat. The burden is not on me to prove the Earth is not flat, okay, to the flat earthers who think that masks should be worn by populations. That's a roundabout way of answering why don't we wear them for flu, because they're known to not work. That's why.
So why don't we start calling them splash guards? Would that be fair enough? Fair?
Yeah, there's a lot of names for them. I don't want to go down that pathway.
Is there a relationship between latitude and infection rate? It seems like warmer states and countries have lower infection rates, and maybe that's a question that you could ask in terms of people of darker skin, maybe having different vitamin D levels and being more susceptible to this as well.
Yeah, there's a lot of things that are not known about virus, including influenza, by the way. There's all kinds of things about why is influenza in the winter and not the summer. I mean, there's a lot of potential reasons. There's a lot of sort of explanations. Humidity, you're indoors more in one, the sun. There's a lot of explanations. But the reality is that a lot of it isn't known because there's too many differences when you talk about what happened in India or Brazil versus the U.S. I mean, there's just too many differences. When we look at the U.S. in general, you can see, as I alluded to in my slides, that, okay, places that are warm, they get it at a cross-section in time where other places didn't, but then it's a cycle, and it cycles through these areas, and then the other places get it. So I'm not so sure about the why, but yeah, there are a lot of factors. There's no clear sort of unique reason to explain some of these differences, really.
Okay, so I'm going to combine just a few more questions here.
Sure.
And one is, public health officials continue to put more policies in place in the name of, quote, public health that strip us of our constitutional rights. The Children's Health Defense is suing Governor Newsom, arguing that the emergency is over. With Omicron being mild, the facts are on their side. Do you agree, and would you comment?
Well, I agree that Omicron has had less severe consequences. That's factually true. That's not arguable. The question is why, and there are three possible reasons. Number one, it's a milder variant. Number two, it's less harmful because so many people have natural immunity from recovery. And number three, so many people have protection against death from the vaccine. Okay, it's impossible to sort this stuff out, really, but the nature of pandemic evolutions suggests that this is like other pandemics. That is, that the ultimate pathway out of a pandemic toward what's called endemic viruses, which mean it is occurring, which means that less lethality variants are predominating, and eventually we will have this virus probably forever, but it will come and go in less and have less lethal consequences with less severe consequences. So in that sense, that's point number one. We don't know yet if we're done with the pandemic. It depends what your definition of done with the pandemic is. We're not done with the virus, but that doesn't mean we can't live normally. I already said that for a year and a half, Florida's been living normally with no difference compared to states that weren't. So it has nothing to do with Omicron, really. It's good news that Omicron seems to be far less destructive, lethal. The second part goes back to what we keep, what many people don't acknowledge. Healthy children do not have a significant risk for serious illness and have nearly zero risk for death from COVID, pre-Omicron. This is not new information. This has been here for more than a year and a half. Almost 2 years now we've known this. So to think that there's some kind of emergency, that schools need to be closed, that children need to be masked, that children need to be vaccinated, I don't understand the logic of these things. It is defying all the science.
Okay, so there are a lot of questions left, and Dr. Atlas volunteered to answer as many as he could, so I'm going to let you do that offline. But I want to ask you, in closing, what you think we should do.
Yeah.
The people in this room are brave and patriotic, care a lot about their country, and if you could just give them some encouragement and advice about how they can make a difference, that would be great.
Yeah, so I mean, the answer to what we can do as people, I mean, the first part is we must be involved. Okay, the days of being passive are over. The question often asked to me is, when will the CDC say we're done? When will Dr. Fauci say it's over? When will these people say X or Y? I said this before, but the expectation should be that they will not do that. That means it's your burden to make these thinking, thoughtful decisions for you and your family. But it's also very important and impactful to be public. One of the things, and that requires a certain amount of, I'm not going to say bravery, but I think you can be afraid, but you still have to realize the consequences of being silent. One of the things that struck me, there were two things that struck me the most during this whole fiasco. One was the incredible power of the government of a free country to shut down schools, homes, personal movement, seeing your parents, behaviors, business closures at their whim with no accountability, no end in sight, no defined end. But the second thing that shocked me even more was the acquiescence of the American people to these kinds of edicts. And that is different from anything I would have expected, anything that we saw in other countries. We see other countries, Spain, Italy, Germany, the Netherlands, France, our so-called peer nations. We see tens of thousands of people protesting these kinds of lockdowns and these kinds of vaccine passports and mandates. I think I'm shocked at that we, the country founded on individual freedom and liberty, have really, to a great extent, not behaved like that. Where are these tough New Yorkers? I grew up in Chicago when it was I was a kid, and when the original Mayor Daley was the Democratic Party. I mean, I don't remember growing up in a place where people were so afraid and compliant with things that were non-scientific. So that's another thing. We have to be thinkers and make our voices heard to the people who you control, because this is a democracy. And we have to talk to the people we elected and make them know what we feel as people. I think the school board issue is very important as an immediate action item. People that care that their children's schools are closed, that their 7-year-old is required to sit in a mask all day, when there's no science behind that whatsoever, proven by other countries' experience. We could be on the school board. Okay, that's another example of how to be involved personally. And then sort of lastly, one of the things that impressed me from people who I became friends with and colleagues, although I was, like I say, very naive, I didn't know what was going to happen here. But so it wasn't with any brave intent or anything, but what happened was that by being out there, I got hundreds of emails from scientists all over the world, including mainly the United States, including from Stanford University Medical School, including from inside the NIH, saying, Scott, everything you're saying is correct. Keep saying it, but we're afraid. And that was during the sort of spring, summer, fall of 2020. And in the meantime, there were people who said, okay, listen, he's saying this, he's right, we have to say it. And so my point here is that when you come forward, you embolden your neighbor, your friend, your other people, everybody else. The most common reaction to when I show slides and the data is, people nodding their heads, because they know this is true. They had the gut feeling, the logic of it all makes perfect sense. And you, by coming forward, it does give other people the sort of bravery needed and the sort of commonality, because when you think you're the only person, that's a lot different. But when you know that, hey, there's a lot of people here who think the same thing, and then you make your voices heard. So I think it's very important to realize that there's a massive number of people who agree with everything that I've said here. They're not necessarily the vocal people. They're not the people in the media. But the more and more we stay out there and speaking, the more other people will. And that's how you affect change.
Thank you so much.
Okay.
Dr. Scott Atlas, we are so lucky. The nation and the forum are very fortunate to have you.
Thank you very much.
Thank you so much.
Thank you. Thank you very much. Thank you very much. Appreciate that. Thank you.